My name is Elias Jabbour, and I want to update you on my presentation at the ASH meeting. And the first one is Olverembatinib in CML. It's a presentation to be done on Saturday. We know this drug is a multi-kinase inhibitors that has shown activity in wild-type and mutated BCR ALL, including 359 mutation. It does inhibit other TKIs as well. It's a brand new study done in USA to assess the PKs in Caucasian population, and of course, efficacy and safety of this regimen. This study allowed patients who failed prior TKIs, at least 2 prior TKIs. Failure, a patient should not have a response, meaning nobody will be enrolled with the PCR above 1%. And this study will randomize patients to 3 arms, 30 milligram every other day, 40 milligram every other day, and 50 milligram every other day. The duration was 3, 3, and 2. And again, the primary point was the PK studies. These patients enrolled have what we call cardiovascular issues, be it in chronic phase or advanced stage disease. The bulk is chronic phase. I will say 47% of the patients had a cardiovascular comorbidities and make them tough candidates for other TKIs, including Ponatinib. In the study, we enrolled patients mainly in salvage 3 and more, 3 plus, 47% in chronic phase, which is a high number. That tells you that these patients are really resistant to prior therapy, including Ponatinib, where patients enrolled in a chronic phase were resistant to Ponatinib in 65%, overall 72% of the cases. The PK data were equivalent and dependent on a dose given, and the PK profiling was similar to the Asian population, and therefore the study met its endpoint. When it comes to efficacy, we've seen great efficacy overall. In a chronic phase, 78% of the patients achieving a CCOR, 43% achieving MMR. And when you look at the patient who already failed Ponatinib, the rate of CCOR was 83.3%, and MMR was 43%. And among the group who is resistant, it's 78%, which is the best responses seen so far in this group of patients. In 359 mutation, we've seen as well great responses where the rate of CCOR was 87.5%, MMR being 55.6%, which is great. These are chronic phase patients. Therefore, in a multiple resistant patient, this drug is really performing so well. We know as well that responses are durable. The follow-up is around 8 months plus, and yet patients are achieving the response within 3 months, and these responses are being durable. Time to response was 14 weeks for CCOR, and for MMR, it was 24 weeks. Of note, there's patients here who failed asciminib. 1 patient responded, achieved a CCOR and an MMR. In advanced stage disease as well, we've seen responses at different dose schedule. The rate of MCOR was 43% and MMR was around 29%. And we've seen activity across all subset, mainly patients who failed Ponatinib, who are resistant. The rate of responses where 8 patients were enrolled with resistance to Ponatinib, 33% of them responded again. And in advanced disease, yet the follow-up is short, but patients do equally respond. Patient disposition are still mainly on the study. 1/3 of them had to stop the treatment, mainly to go to transplant or other options. From adverse event, there's nothing clinically significant, but you've seen a CK increase, although it's not clinically meaningful. We did not see significant rate of vascular events. So I will say, in conclusion, Olverembatinib has shown dose proportional increase in systemic exposure from 30 to 50 milligrams every other day, and that's comparable to the Chinese population. We've seen extremely high efficacy in refractory population and in patients who failed prior therapies with Ponatinib. And finally, it's safe and tolerated up to 50 milligrams every other day. And the next step is to move to expansion and really have a phase 2 study done and hopefully get this drug available to our patients with CML.